Family and Marital Counseling, Unit 4, Theories in the Psychology of Family Relationships. Secondly, the Roots of Systemic Orientation in Psychology. Introduction. The systemic orientation in psychology is relatively old, and has its roots as a science that studies behavior influenced by certain systems. At the forefront of these systems that affect behavior is the family. The family as an integrated system is rooted in philosophy and sociology. Emil Durkheim noted that human groups can be seen as systems. This idea was slowly accepted, especially by psychologists. However, Kurt Lewin made key contributions to systemic theory, known as field theory. This idea received weak and slow acceptance from psychologists, who continued to see the human being as the unit for mental study. Kurt Lewin made key inputs to systemic theory. Lewin's input consists of rules and ideas he created, inspired by natural sciences, known as field theory. Kurt Lewin and field theory. These ideas were part of a broader scientific movement, a shift from mechanical and atomic theories. Lewin applied these ideas to human group studies. First, field theory. Its ideas weren't Lewin's alone. They were part of a broader scientific movement. It challenged 19th-century theories, which saw events as forces between static particles. The debate was whether one could predict a particle's properties based on interactions. While often accurate, 20th-century advances revealed unexplained scenarios. Studies showed forces might change due to the fields they inhabit or move to. This theory proved accurate in many cases, but the technological advancements that occurred in the 20th century created some situations that scientists could not explain, according to the previous particle-based conception. Some studies have shown evidence that these simple forces themselves could change due to the fields of force in which they existed, or the fields of force to which they were transferred. In other words, the behavior of any particle depends only partially on its own properties and distinctive characteristics, because it is also influenced by the state of the field it is in, and this field is, of course, affected by the presence of other particles within it. This theory has proven accurate in many cases, but technological advancements created some situations scientists could not explain by the old particle view. Some studies have shown evidence that these simple forces themselves could change due to the fields of force in which they existed. In other words, the behavior of any particle partially depends on its properties, because it is also influenced by the state of the field it is in. If we swap particle with person in the previous sentence, we better grasp the living hypothesis suggesting that human behavior is a function of the life space, resulting from person-environment interaction. In other words, the behavior of any part depends only partially on its own properties and distinctive characteristics, because it is also influenced by the state of the field it is in, and this field is, of course, affected by the presence of other particles within it. When we replace the word particle with person in the previous sentence, it becomes easier for us to understand the living hypothesis, which suggests that human behavior is a function of the life space, which in turn results from the interaction between the person and their environment. Person and their environment. Lewin's model shows individuals as bounded forms within larger life space boundaries, influencing behavior. He didn't treat families as groups, but his group theory challenged prevailing family views. His ideas sparked a revolution against psychiatric practices that isolated patients from families, a perspective that changed after him, which may include all factors influencing an individual's behavior at any moment. Lewin did not treat the family as a group, but his theory about groups raised doubts about the prevailing views on the family. Lewin's ideas contributed to a revolution against psychiatric practices, where psychiatrists insisted on treating patients away from their family. This perspective changed after Lewin, as many psychiatrists began viewing the entire family as the patient, introducing family psychotherapy. Lewin presented two formulations derived from Gestalt psychology, fundamental for studying family systems. These formulations state that parts and elements do not exist in isolation, but are organized into holistic forms. It is worth noting that because of Lewin's ideas, many psychiatrists began to view the entire family as the patient, thus presenting a new field for family psychotherapy. There are two formulations that Lewin presented, which he derived from Gestalt psychology. They are basic formulas for studying family systems, namely that the parts and elements do not exist in isolation from each other, but are organized into comprehensive forms. Behavior is more dynamic than mechanical. Lewin's field theory explains how a person's behavior varies with different situations due to changing conditions. The philosophy of transactional interactivity balances Lewin's method, based on Hegel's dialectical principle. Transactionalism is particularly suitable for studying human communication, which should not be seen as a simple action-reaction model. This is the development of the philosophical concept known as transactionalism, which is a rephrasing of the dialectical principle established by the German philosopher Hegel in the 19th century. Although transactionalism can be applied to all types of subjects, it is particularly suitable for studying human communication, which Peabody and Westall described by saying that human communication should not be understood as a simple model of action and reaction. Rather, as a system, it should be understood at the interactive level. The average person tends to think about their behavior and the behavior of their family in terms of simple cause and effect relationships or stimulus and response. Family members are often seen as either positive or negative. This thinking is common. This view prevails in family and marriage counseling, where members often try to blame each other and win the counselor over. In systemic psychology, this thinking can lead to pitfalls. Studying communication between two parts can be misleading, ignoring the overall state. What is prevalent in family counseling and marital counseling sessions, and often the family members who came for counseling or family therapy, spend the time of the sessions in continuous attempts to blame each other and to try to win the counselor or therapist over to his side and convince him that the other is the reason that brought the family to treatment. Continue. The systemic approach warns of pitfalls. Studying communication between parts can mislead if it overlooks the system's state. An exchange might be just a fragment, not fully grasped by observing only them. If A runs and B chases, A might lead B, or B might chase A. Relationships between two things can't be understood without considering other elements. Factors like forgetfulness and anxiety are meaningless unless seen as part of a whole. Applying this to the family. Pictures cannot be discovered by observing two individuals. Notice a sequence of actions, and it becomes questionable. If person A runs and person B chases, A leads B, or B chases A. Mistake to think relationships exist without considering system interactions. Forgetfulness, anxiety, and spousal treatment are meaningless unless part of a whole. In families, avoid searching for blame, husband or wife, son or mother. Complex data shows relational formations and family rules and patterns encompassing the family. The interactional principle suggests that relationships cannot exist without considering the system's other elements. Factors are meaningless, less seen as part of a whole. In family dynamics, avoid seeking blame between individuals. Analyzing complex data results in narratives of relational formations. The holistic approach views part characteristics as deriving from the whole. In medicine, doctors treat patients as a whole, not just focusing on specific symptoms. Understanding ailments requires a broader view. Avoid searching for causal relationships between individuals, like who is to blame, the husband or wife, the son or mother. Analyzing such complex data results in a narrative of relational formations and family systems. The holistic approach views the characteristics of a part as deriving from the whole. In medicine, doctors treat the patient as a whole, not just specific symptoms. Understanding an ailment, even if linked to a specific organ, requires a broader view. Thirdly, the holistic approach is the perspective that sees the characteristics of the part as deriving from the characteristics of the whole to which the part belongs. This principle has its applications in the field of medicine, where doctors treat the patient as a whole and do not focus solely on specific symptoms or complaints related to one part of the body. Understanding the ailment, even if it is linked to a specific organ, can only be achieved in light of understanding the whole, which is the living being or the patient. Understanding the whole is crucial. The holistic approach views the living being as an interacting component with its environment. The interaction between the living being and its environment or culture is complex. Attempting this risks distorting the unity of the whole. This perspective gained attention in the mid-1950s. This was evident in psychotherapy, where psychiatrists treated patients away from families. The interaction between the organism and its environment is complex. Attempts risk distorting the unity. The view of the family is not new. Since the 1920s, the family has been seen as a unit of interacting personalities. However, this perspective did not receive attention until the mid-1950s. This was particularly evident in psychotherapy, where most psychiatrists treated their patients separately. Family contact was seen as a weakness or a sign of incompetence. Even when therapists began to discover that the mother, for example, affected her son's illness, the son was viewed as an innocent victim of a bad mother. In fact, contact with the family was seen as a weakness or a sign of the therapist's incompetence. Even when therapists began to discover through practice that the mother, for example, contributed to the development of her son's mental illness, the son was viewed as an innocent victim of a bad mother. This reflects a lack of understanding of the systemic perspective and a failure to see and diagnose the illness from a systemic angle.